You're listening to Be Health Connected, a podcast by the Gateway Business Health Coalition. Your host for today's episode is Kaylee Delaschmidt, BHC Manager of Wellbeing Strategy and Member Services.
Hello, and welcome back to BHC's Be Health Connected podcast. I'm your host, Kaylee Delaschmidt, and today I'm excited to be joined once again by the President and CEO of the Gateway Business Health Coalition, Laurel Pickering. Laurel, it's so hard to believe that it's already been a full year since you stepped into your role leading BHC and our sister organization, the Midwest Health Initiative. You know, we've accomplished a ton over the past 12 months, and you've brought a lot of fresh energy and vision to BHC, and obviously enhancing, our mission and goal of improving health, well-being, and value in healthcare for St. Louis and beyond, right? So over today's conversation, we'll reflect on what's been accomplished, what we've learned, and give a little preview of what's ahead. So welcome back and happy belated 1-year anniversary at BHC and MHI.
Thanks, Kaylee. It has been an amazing year. I've been so thrilled to be back in the coalition world and especially in St. Louis. So I'm really happy to talk to you about what it's been like 1 year in.
So in preparation for this conversation, I went back and listened to the podcast episode we did together in July of last year. And like I said in the intro, we have been so busy. I'm not telling you anything.
Yes.
We've made so much progress on the goals and themes that you outlined in that podcast episode. And so I have some questions teed up for you. We'll start with probably one of the biggest changes since last year is that we have a new name. Do you want to walk us through the rebrand process and maybe take this opportunity to share a bit about the vision and meaning behind our new identity?
Yes, this is one of the most exciting things that I was able to lead this year. Over the years, BHC has grown to serve many national employers with employees outside of the region, as well as many employers who are not even in Missouri who purchase pharmacy through us. And we really wanted all employers to feel included, which is why we switched the name from St. Louis to Gateway. And Louise also recognized that the name needed to be changed and was completely on board, but she decided, let the next person deal with that and spearhead that. The Gateway name was perfect for us because it's a nod to St. Louis. We are the Gateway region, the gateway to the West, our roots with Lewis and Clark and the Arch, but it also stands for Gateway to Health. Gateway to better purchasing, gateway to all the things that we can bring our members to help them provide better value benefits to their organizations and to their employees. We think the launch went great. We've gotten wonderful feedback, and we are still, though, the BHC. New name, same old BHC.
I love that. It's only been 4 months, but it feels like we've been Gateway BHC for forever now. During our last conversation, you specifically mentioned the value BHC brings to members through a few of our key initiatives. You said the Pharmacy Management Initiative, the Midwest Health Initiative, and our policy and advocacy work. So I want to dive into each of those a little bit more. Under this new name, we've made a lot of updates and enhancements in those areas. So starting with the pharmacy program, what's new there?
Yeah, so those you listed quite a number of our programs and initiatives that I was excited about in joining as the new leader. So when it comes to pharmacy, well, you need to be living under a rock if you haven't heard about the scrutiny on PBMs and also the increased focus on transparency and plan sponsor fiduciary responsibility. When you take those two things into consideration, it's time to look at new models and new partners. So the first thing we've started doing is educating the members, educating our employers about different aspects of PBM pricing, PBM models, and really having them understand, like, what does traditional pricing mean? What does spread pricing mean? What is pass-through pricing? What are the various elements that make up the PBM program that we should really know about, focus on, and that should be transparently available to us? We had a PBM forum this spring where we brought in innovative PBMs, alternatives to the big three PBMs, as well as specialty carve-out companies. And the biggest goal was really to educate the employers and the members about what else is out there and how the model for PBM purchasing is changing. And I think we opened a lot of eyes and had our employers now thinking about their current arrangements as well as what they could do differently in the future. And, as you know, Kaylee, we have CVS and ESI as our current PBM partners who have been great partners. I mean, we've been with ESI for so many years, and, we're challenging them as well. And one thing that I don't think our members really thought about who are in the PMI program is that they have the option within our contracts with ESI and CVS to have two different pricing models. One is traditional pricing or spread pricing, and one is pass-through pricing. And so we are working with ESI and CVS to educate the members about what's already available to them in the current contracts that we have. They can do pass-through pricing with ESI. They can do pass-through pricing with CVS. And I know both of those organizations are also focused on transparency and, coming along into the future, as we are really focusing on those things like transparency and fiduciary responsibility. We do hope to select an alternative transparent PBM in addition to our big two partners that we can offer in the coalition for those employers that are interested in taking a different route and doing something different.
Thanks for sharing all that detail. The PMI program has been around for over 20 years now. I think it was in 23, we celebrate its 20th anniversary. And so I think it's really important for obvious reasons that the program continues to evolve to meet the needs of the employers utilizing it and under the program today. So these are all really exciting changes or updates. Switching gears a little bit to talk about the Midwest Health Initiative, BHC's sister organization. For those that don't know what or who MHI is, can you give them a brief reminder and then tell us about what services it provides to BHC members and the broader community? And then to add on to the third question for this question, what listeners can expect to see from MHI in the coming year?
Yeah, the Midwest Health Initiative was also something that excited me when I thought about coming to lead BHC. It's our sister organization, and it's a multi-stakeholder organization where BHC is employers only. The board is employers only. Only employers can be members. Midwest Health Initiative is multi-stakeholder. Our board is made up of health plans, health systems, employers, and healthcare purchasers. And we also have representation from the Hospital Association, from the Primary Care Association, and it's really a community-wide organization. What it has predominantly done is act as a repository of data that we can use to measure the quality and value of care in our community. And we have looked at specifically St. Louis, but we've also looked at Kansas City and other parts of Missouri. Given the multi-stakeholder nature, it's a wonderful opportunity to be able to bring all the perspectives together, once we have this data and determine together how we use it and how we make it a benefit to the community to improve healthcare and healthcare value. We have been going through a strategic planning process to think about how MHI can evolve and what benefits it can bring to both the community as well as to the employers who are members of BHC. And there are two avenues that we are exploring and very excited about. One is, given that we have an amazing data analytics team, how can we make them available to our employer members who are struggling with their own small teams where they're trying to get big things done with very little resources and don't have the luxury of exploring their data in ways that I know that they want to. They have a lot of questions they want answered. They have problems they need solved, and they either don't have the time, the resources, and resources means money to spend exploring all the questions that they want to. So we are talking to the members about how we can help and how can we bring the MHI data analytics team to solve some of those issues that employers are having around data. The second opportunity that we see for MHI is to capitalize on its multi-stakeholder structure, and we are going to be doing more meetings where we bring together all the stakeholders, mostly health plans, health systems, employers, healthcare purchasers, to solve tough issues where we are better together than we are alone. One example of that is we are exploring value-based care in the St. Louis market. Where are we on the path to value-based care? And we are interviewing our health systems, talking to our health plans, and doing an assessment where ultimately we hope to bring together health plans, health systems, and purchasers to see the results, talk about where we are as a community on this path toward greater value, and what can we do to accelerate, getting there with the various stakeholders. So those are what we're thinking about for MHI, capitalizing on our strengths, right? Our multi-stakeholder structure, and then our data analytics team that we think, can help our members as well as continue to evaluate the cost and quality of healthcare in the region.
I especially appreciate the opportunity to call out MHI because it's a huge added benefit to employers who are already members of BHC that I personally believe not enough of them are leveraging today. And so it's exciting to hear about these different ideas and opportunities that we have to try and make sure that they are capitalizing on what they already have access to.
Yes.
Switching gears again to policy work as a key value for members, the legislative session that ended in May, just a couple months ago, was very fast paced and somewhat challenging from what I understand. What did you learn, and how is BHC updating its approach to policy work? And lastly, what do you think we'll continue to see in terms of legislative efforts that impact employer sponsored benefits?
Yes, I learned a lot in the first year and going through the first legislative session with the Missouri legislature. I did spend time in Jeff City, and I've done a few visits to Capitol Hill in DC. And I think one of the biggest things that I've learned is that even though you may seem like you're on opposite sides, there's usually common ground to be found. And I think that's an important role for, and something we need to do as a business coalition and as an organization in its community. To make progress, you need to find common ground. At the beginning of the year, I testified about limited pharmacy networks and how important it is for our members to have the ability to limit networks as a cost savings tool. So whether it's related to pharmacy or whether it's related to the medical network, employers need to have the ability to do that. Well, I didn't make the Missouri Pharmacy Association very happy when I said that. And, they publicly came out against my comments, which, I can understand that, thinking from their perspective. Well, over the past few months, we have found a number of areas, us and the Missouri Pharmacy Association, where we are on the same page. And we are going to be working with them soon on next year's bill to come up with something that we can all agree on. So that was a learning experience, and it was just a reinforcement that when we find common ground, we can be extra effective and implementing change, that will benefit all of us. So stay tuned. That's something that, we are going to be working on, is trying to lay the foundation now until January on legislation that can be enacted that will, benefit ultimately cost and quality of care, right, for our residents and for our members. A couple of other things I want to say about policy, and a message certainly to employers, is what I've also learned is legislators and policymakers want to hear from employers. They want to hear from the people, the organizations that are being affected. And we have a lobbyist that we work with, that we pay, as part of the membership. And it was a great step for the legislators to hear from me, as opposed to our lobbyists representing the business community. But they really want to hear from the business community. And we are going to be forming a legislative task force where we will get input from employers on the things that they care about. We'll get their input on legislation that's being posed so we can accurately represent the interests of our members. But then we are also going to try to recruit our members to go to Jeff City and maybe even come to DC. I know sometimes employers are shy about being public on certain issues, which we understand, but we know that there are some that they can be public on, and we're going to try to encourage that and get our employers more engaged in policymaking.
It'll be a nice way to get employers more involved in that conversation with the addition of this policy task force that you mentioned. I agree, after having visited DC a couple times myself, that they appreciate the perspective that coalitions can provide, but they have a tendency to listen and then kind of look over your shoulder a bit. And which employers do you have with you, and how do they feel about what you just said? So it'll be a good opportunity. All right, so we went over those three key initiatives or programs, if you will. Let's shift gears and talk about events. Since you came on, we've brought back the Wellbeing Roundtables and launched new events like the Mental Health Action Lab and the Innovation Forums. I think they've all been really well received. I would love your thoughts on how it's going.
I agree with you, Kaylee. I think they have been really well received. And one of the biggest benefits of a coalition like ours is for the members to get education and to network with each other. They want to talk to people doing the job that they're doing, and what have they learned, and what can they pass on. And that's why bringing back the Wellbeing Roundtable was so important. And we've added other roundtables, the Executive Benefits Leaders Roundtable, the Global Benefits Roundtable, and really just offering these opportunities to members to just interact with each other unscripted and learn. You mentioned the Mental Health Action Lab. Since I got here, we have taken on the topic of mental health as a priority. Our community forum in April was focused on that. When I did my listening tour and met with all the members, it was something that some employers were focused on, and something that other employers wanted to focus on. So it was a clear message that this was something that we should address. And after the April meeting, we started the Mental Health Action Lab, where employers can drop in and have access to an expert, again, unscripted. Ask your questions, whether you're at the beginning of the journey, the middle of the journey, or feel like, you're pretty sophisticated. There's always questions. So that has been a great resource for our members. The innovation forums were something that I thought were critical to start. When you go to have education and you're trying to learn, we really try to limit the sales pitches. Every coalition tries to do that. The solutions, the vendors, they want to tell their story, but I think there's a proper place for that. And I wanted to give it a place. I wanted to give it space. I wanted to give the solutions an opportunity and be transparent about it. So we started the Innovation Forum, and we have done 2 so far, the third one set for September, where we have invited solutions to come and tell their story and give a pitch. And I think it's gone pretty well. Our members have now been exposed to innovation that they maybe didn't know about before, and just have an idea of what's going on in the world that they might have access to or that might benefit them. So in answer to your question, Kaylee, I think it's gone really well. We've had good attendance. We'd love feedback from the members on whether it's been of value. And, real thank you to you because you're a big part of putting on a lot of those programs, those roundtables, and organizing everything. Obviously a big theme is that yes, I'm here a year, but we have an amazing staff that were all here before me, and we couldn't do any of what I'm talking about without the amazing staff. So definitely have to do a shout out to the team that works so hard on all these programs, initiatives, and events that we have.
Well, I really appreciate you throwing that in there. That's so nice. And one thing I'll add before we switch to the next question is how much I've appreciated the revitalization of the roundtables. They, from what I understand, were BHC's bread and butter, before the pandemic came and gatherings were, a little less common. And so in June of last year, I remember doing a survey of the members. And one of the questions was, what do you want to see from BHC? What do you want to see us bring back? What do you want to see us bring new? And the response was overwhelmingly the roundtables. And so I really appreciate that you've helped us make that a priority. And I think that the members really appreciate it too. And then my other reflection or thought is the innovation forums. They've kind of been the happy medium for me personally because I get feedback that Kaylee, I'm interested in all these things, but I simply don't have the time or the team to know about everything and everyone all the time. And likewise for, the solution providers, we want to tell everyone our story and the value that we bring, but we can't reach them and we know that they have too much time. And so, it's one forum or event where employers come and they know they're going to learn something, and solutions come and they know that they're going to be able to tell their story, and everyone knows why they're there and they're all happy to be there, and then we facilitate those connections afterwards. And so in my opinion, it's so much more efficient than maybe having like a sponsor presentation where like you're talking about a topic but like really they're trying to find a way to squeeze in their story. And so just wanted to throw that in there as one of my own reflections. All right, so reflecting on your first full year as president and CEO, what has surprised you the most in either a positive or a challenging way, or both?
I think what has surprised me the most is that there's a real opportunity here to try new things. And I have found that where I have seen things happening or tried in other markets, we've been a little bit more conservative here. We are the show me state after all. And, I think employers and healthcare purchasers, they want to be shown that something works, it has value, and it's going to deliver. So I've taken this, as I said, as an opportunity to put new ideas, new solutions, think about new ways to deliver medical benefits, pharmacy benefits, revamp your culture, focus on mental health. And I've found that people are very receptive. We have a couple of employers that, have been to a program, been to the National Alliance Conference, and I feel like their eyes have been opened and they have said, you know what, I'm going to purchase differently. I'm going to do things differently. And that's really gratifying, and it gives me hope that others will be open to new ideas, new ways of delivering benefits. At the very least, I'm going to have one or two that can show them that it works. And so I'm very, very excited about that. I'll add one other thing about being surprised. And I actually wasn't surprised, but something that's been so positive, which I just mentioned, is the staff. And it's such a great team. And I, haven't made any changes. Unfortunately, people have left for other opportunities, which is understandable. But I've been very blessed with a great team that has supported me in my first year in an amazing way. So I just want to, again, another shout out to the staff and the team, because everything we're talking about, I'm not doing alone at all.
Well, the feeling is reciprocated. We've appreciated the opportunity to do and learn new things, and it's wonderful when it works out that way for everyone involved. What about some key events that you have in mind or that we have coming up on the calendar? Do you want to take this opportunity to share a little bit about that?
Yes, we spent a little time talking about the innovation forums, and I'm very excited about our September innovation forum. This one is specifically going to focus on new models of care delivery, new health plan models, and we are going to have 6 presenters. We're going to have 2 traditional plans sharing new models that they have developed. We'll have United Healthcare talking about Surest. We'll have Anthem talking about Coop Health. Then we're going to have 2 new health plans in the market, Centivo and Medica. And then we are going to have 2 of our health systems, Mercy and BJC, who are going to be talking about their direct to employer products. They would love to directly contract with the employers in the market, and there's huge value to that. Very excited, again, to share innovation, new models, new ways of delivering benefits. Our annual meeting is in November, and I think the annual meeting theme will always be, at some level, employers driving change and empowering employers to create a value-based healthcare system. I'm still working on the agenda, but I can tell everyone that we are going to have Leah Binder, who's the president and CEO of the Leapfrog Group. And the Leapfrog Group is focused on hospital patient safety. We are a regional leader for them. And Leah has a great message, clearly around the importance of patient safety, but also the role that employers can play in driving improved quality of healthcare. The Leapfrog Group was founded by employers many years ago with the idea that they can use their leverage to drive improvement in the system. So very excited to have Leah with us. And then going all the way to next April, we already have the topic for our community forum. We're going to be partnering with another organization to focus on-site and near-site healthcare and clinics, and also direct provider contracting and direct provider relationships, similarly to how we just talked about, Mercy and BJC being at the Innovation Forum. So we're excited to have that topic already set for April's Community Forum.
Great. And there were a couple of things that came to mind as I was listening to your response. So you talked about the Leapfrog Group and how they will be a keynote at the annual meeting in November. I wanted to put in a plug for BHC's consumer guide that we have and maintain that incorporates the Leapfrog safety grades for all the hospitals in our region that we provide copies to all of our employer members, and we can also give them out to members at employer events at request. So please reach out to us. We can also tailor that document to regions outside of St. Louis, obviously, because the Leapfrog safety grades are available nationwide. So an opportunity to mention that. And then some other cool events that we've been doing recently that I forgot to mention earlier in our conversation are these workshops in partnership with National Alliance. And we've talked, I believe last episode, we talked about how we intend to partner with National Alliance more closely. And so we've been working with them to provide a high cost claims workshop for our employer members. And they have access to a medical director in the employer claims space and come up with an action plan on how they can address high cost claims for their organization. And then we've also been partnering with them on an employer benefit strategies to end the HIV epidemic workshop series. And so those are currently underway, but we're going to be doing more of that with them. And so I think that's an exciting opportunity for the rest of 25 and certainly into 26. As some continuing education and opportunities for collaboration.
You brought that up because we are going to be partnering more with the National Alliance. I am, back on the board, which is exciting. And their annual conference is in November, and I am going to be doing a push to have as many of our members attend as possible. So stay tuned to our members. Stay tuned for more information on that. But thank you for bringing that up, Kaylee, because that's a really important part of our future and what members can expect from us.
Well, do you have anything else you want to share before we wrap up for today?
Yes, and maybe this should have fallen under the surprising question that you asked me, but I just appreciate how welcoming everyone has been. A few people have personally taken me under their wing. They've invited me to do things on the weekends because I think most people know that I was here by myself for a year until my family moved. And they've done things like taken me to wine country or, taken me hiking. And I've just really, really appreciated that and how welcoming the community has been. I'm also still shocked, and I think I mentioned this in our first podcast, that how I run into people that I know all the time. I had that first experience 3 weeks in running into Dave Thompson and Straub's, but I have since run into people in the airport, in a boutique in Washington, Missouri, at the gym. I ran into someone this weekend at Tower Grove Park, and I just love that about St. Louis. And it makes it a very unique place. I am thrilled to be here, and I'm excited for the next year ahead.
Well, and so are we. But I really appreciate, I know firsthand how packed your calendar is. So thank you so much for carving out time to join me today on our podcast again, and for all the work you continue to do for BHC, MHI, and our employers. It's greatly appreciated. And thank you to all of you who joined us for this episode for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the Gateway Business Health Coalition, please visit www.gatewaybhc.org.